Let us discuss today about our immune system and how we can boost it. We do not think of our immune system in our body when it comes to health conscious living, but we are more concerned with our cholesterol levels to keep the ticker working. Immune system is a very complex system composed of cells and proteins defending us against infections. Proteins are amino acids. These compounds help turnkey players in your immune system, T cells, B cells, and antibodies, into germ fighters that spot and kill harmful cells that enter your body before they can start an infection. So, how do we improve this complex network to live an infection free life, especially relevant today when we are afflicted with the worst deadly virus spreading globally? Numbers are in flux but appears worse than the seasonal flu. The immune system keeps a record of every germ or microbe ready to attack us, making provisions to destroy quickly when it enters the body. And our body develops an immune system to prevent further invasions. These records are kept in the white blood cells labeled the B and the T lymphocytes, and hence referred to as the memory cells. The principle involved in vaccination is all about that. The dead attenuated germ is injected just under the skin for our inherent immune system to activate and build antibodies, or call them defensive soldiers, to attack the enemy, or to be exact, destroy the antigens, the proteins elements in the germ or microbe. A weak immune system can cause recurrent infections from external sources, can lead to allergic diseases, immunodeficiencies, and autoimmune disorders. The main components of this army in our body that fights infections are the white blood cells, antibodies, the complement system, the lymphatic system, the spleen, the thymus, and the bone marrow. Will antibodies form for the antigens in coronavirus? Now, for the first time, researchers at Peter Doherty Institute for Infection and Immunity understands how humans fight off viruses. Laboratory head Catherine Ketsiska found people's immune system responded to coronavirus in the same way we try to fight the flu. The immune cell populations we have seen in emerging before patients recover are the same cells that we see in influenza, she said. Very little is known about how coronavirus acts as it is so new. In the new research, scientists have taken the blood samples of one Australian's first patients diagnosed with coronavirus and identified the antibodies recruited by the body to fight the illness. It's the first paper that shows the body can give immunity and fight back and recover, researcher Caroline Van de Sands said. This information will allow us to evaluate any vaccine candidate, as in an ideal world, the vaccine should mimic our body's immune response, said Professor Ketsiska. Let's talk about the busy little bugs in the gut that supports our immune system. About 70% of the immune system lies in our gut. Healthy, balanced gut flora makes for a strong immune system. We need to care for their well-being and the diverse ecosystem to boost our immune process in the body. Prebiotics like resistant rice, onions, high fiber foods are their foods also. Fiber in the foods are digested and fermented by these microbes to produce chemicals to safeguard the health of our gut and elsewhere. Probiotics such as yogurt, kimchi, sauerkraut supplies the good bacteria to safeguard our immune system. Does coconut help to minimize the spread of coronavirus? Out of all cooking oils that we use, coconut kernel or the meat and the coconut milk seem to have antimicrobial effects due to lauric acid making up to 50% of the fatty acids. They destroy harmful pathogens such as bacteria, viruses, and fungi. Olive oil, on the other hand, so popular in the Mediterranean countries, used as a cooking oil, has no antimicrobial properties. Do we observe that the people who live in countries where coconut kernel is used daily as milk to flavor and thicken the curries, and the rice and curry being the staple diet, the incidence of the rate of spread, morbidity, and mortality from the coronavirus is much less. In India, for instance, with a population of 1,369 million, only 47 have contracted the disease and only 3 have died. Thailand, with a population of 69.8 million, 212 have contracted the virus and 3 have died. Pakistan, with a population of 197 million, 254 have contracted and have succumbed. Sri Lanka, with a population of 21 million, only 43 have contracted the disease and no deaths, while Australia, with the same population, 456 have contracted and 5 have died. Malaysia have a population of 32.37 million, 790 have contracted and 2 have died. Japan, with a population of 126 million, 476 and 461 people, 835 people have contracted and 21 have died. Most Western countries like US, UK and Mediterranean belt, over 1,000 have contracted the disease and the death rate is much higher. Of course, we are aware this virus may affect people in different countries differently. From these stats, it appears that the medium-chain fatty acids, lauric acid, seem to minimize the incidence of spread and death among people who eat rice and curry. Do common spices and herbs have antiviral properties? Common kitchen herbs such as basil, sage, oregano, and spices like chilies, turmeric, coriander, ginger, garlic, and other curry powders used daily to spice up curries have powerful antiviral effects against numerous viruses that cause infections in humans and maybe against the COVID virus too. I visited one of the spice shops in Sydney, and the sale of spices, rice, pulses, seeds, canned products have been sold much more than previous months. They have enough stocks to cater to the regular customers in Sydney with no shortages in the future. Conclusions is that those dietetic ingredients used by the Asian cuisines may have a deleterious effect on the coronavirus.
This is an ABC podcast.
Hello, this is CoronaCast, a daily podcast that's all about answering your questions about the COVID-19 epidemic. I'm physician and journalist Dr. Norman Swan.
I'm health reporter Tegan Taylor. And Norman, a lot has happened since our last episode. We're now in the hundreds of cases here in Australia.
Yeah, it's gathering pace. At least one model has us going on an exponential curve. You know, the curve is going almost vertical, albeit from a low level. So that's something that indicates we need to do more. And there's been a big debate in Australia about large events and so on. And the Prime Minister's come out making certain comments, so we're getting more restrictive about travel bans, more restrictive about public meetings and so on. So it is time to do more than we have been doing to try and control it.
We start every episode of CoronaCast answering your questions, so if you want to send one in, head to abc.net.au/coronavirus. And one thing I'm seeing is that people are still really interested in basic advice, so let's recap. What's the best way to avoid getting sick?
Well, it's hand washing, it's avoiding large crowds, and hand washing can be with soap or hand sanitizer, soap is better. Avoiding large crowds, avoiding close contact. If somebody's got symptoms, you should stay out of the public mix. If you've got a cough and a cold at the moment, it's still statistically far more likely you've just got a cough and a cold, unless you've had contact with somebody with COVID-19 or somebody who's just come off a plane from overseas, or you have come overseas. And hand washing is the main thing. Masks don't really help in the current situation because you're wasting a resource that could be used by health practitioners. Social distancing is really important, and that's about working from home if you can, not mixing with large numbers of other people. If you don't have to go on public transport, don't. Then the question is, do we have large meetings of any kind? And my view is we should be starting to really clamp down on that. Should schools shut? My view is probably yes, but it's controversial because some places where they've controlled the epidemic, the schools have stayed open, like Singapore, Hong Kong, and parts of China. But that's been complicated by the fact that schools have had holidays during that period in those countries, so it's not entirely sure what the school situation is. So that's an open question that's going to progress, but as we get nearer to Easter, it may well be that we give kids a longer holiday than they otherwise would have.
Right. So you mentioned public transportation. If you have to travel by bus or train or whatever, what are some measures you can take? Should people be thinking about wearing gloves when they're on the bus or train?
Not really, because gloves are going to pick up the bug too, so they don't protect you against the bug. So I don't think gloves are actually going to help you. I think it's avoiding touching surfaces, avoiding close contact. If it's a crowded train, maybe wait for the next train. These are not easy things to do. And washing your hands as soon as you get off the train and not touching you're really being obsessional about not touching your face while you're on it. Those are the basic rules there, but it's not easy to control.
We've had some questions as well about just routine medical appointments. People still get sick and still have other medical needs, even in time of pandemic. So I've got one question asker asking if they should postpone a routine colonoscopy or another non-urgent medical visit.
So I'm not sure there's any such thing as a routine colonoscopy. So you need to have a conversation with your doctor or specialist about how essential that is, how long you can wait. The problem at the moment is that if you wait, it's not necessarily guaranteed that you're going to be able to be seen in a month or 2 months, because if the system shuts down because it's overloaded, you may not be able to get in. So you've got to take a longer term view, I think anyway, over the next few months and talk to your doctor about that. If I don't get this colonoscopy between now and 3 or 4 months' time, is that going to make a difference? Maybe yes, maybe no, but I'm not making the answer up for that. You've got to discuss that for yourself, come to a rational conclusion. And before our system gets unburdened, I'm not saying we should have a rush on the health system like we've had a rush on toilet paper, but you should, if you know you've got an appointment, I would be keeping it or talking to the doctor about it. But if you've got a cough and a cold, don't go anywhere near the surgery because you don't want to pass it on to others. That's just prudent anyway.
What are we looking at over the next few days, weeks, months? You mentioned a vertical curve of like a trajectory. Can you unpack that a bit for us?
In Australia, we've done quite well so far, but that's been largely because of border controls. We've stopped people coming in from China, then there's Italy, Iran, South Korea, and so on. What we haven't done is put a travel ban in the United States, and we've had imported cases from there, and that's a real problem, and that's been a political decision, I suspect, whereas US has been a little bit less shy about instituting travel bans into America from elsewhere. So that's been one thing. And we've been quite good at contact tracing. So you identify people, you test them, you find out people with COVID-19, and then you find their contacts over the last few days. And that's another reason, by the way, for not having mass gatherings, because if you've picked it up from a football match, almost impossible to do contact tracing. So the countries that have controlled this well have been obsessive compulsive about finding cases, doing huge amounts of testing, very sophisticated testing, sometimes more sophisticated than we've got in the United States or Australia, and then contact tracing really aggressively to find out everybody that you might have contact with, and they go into self-isolation and are watched pretty closely. And then in Singapore in particular, but I think in Hong Kong too, when they find an area where there might be a cluster, they really land on that cluster or that area and make sure that they try and control it in a geographic area of maybe a 5 to 10 kilometer radius. And the other thing that happens in Singapore, I don't know about other places, is that there's a WhatsApp, and a couple of times a day you get a message from the Singaporean government, which is very frank, tells you exactly what's happening, and tells you where things are happening, gives you information so that you can change your behavior. And so if we do all that, and a country does all that, then you will slow the curve and reduce the pressure on the system. And so best case scenario is that it is a slow rise leading to maybe June, July, where it peaks, and then a slow decline over the next few months as more people develop immunity to it or have had the disease.
But it really relies on us all doing our bit.
Each one of us has to change our behaviour to protect the community as a whole. And it includes our parents and our grandparents, people in the community we don't know who've got cancer and have cancer chemotherapy and so on. People are dying, and you just got to listen to the stories coming out of Italy. It's heartrending.
Some good news. A 103-year-old Chinese grandmother has made a full recovery from COVID-19 after being treated for 6 days in Wuhan, China. All 7 patients who were getting treated at Safdarjung Hospital in New Delhi have recovered. Good news from South Korea, where the number of new cases is declining. So, it's not all bad news. Let's care for each other and stay focused on safety of those most vulnerable. Hope you like this video. Thank you for watching. Bye.